Dr. T.V. Jayanti. I am an ENT surgeon attached to Manipal Northside Hospital. So basically what I want to tell today is that for teenagers, basically initially for teenagers, they use a lot of earphones. So what can happen by using earphones? Listening to music hours together, that too in a loud sound, can cause hearing loss. This can directly lead to a sensory neural hearing loss, which is sometimes irreversible. They wouldn't have realized that there is a sensory neural hearing loss. By and by, they start feeling the blockage in the ear, and then they'll start missing out some words. Well, when somebody else is speaking, they'll start missing out some words, and the speech discrimination will reduce. Hence, they will come to us by the time the damage is done, and they would have lost almost about 30% of their hearing capacity, especially in high frequency. So getting them back to this one is very difficult because it's a nerve damage that has occurred already. So I would definitely tell these teenagers not to use the earphones like that every day for about, they use it for 3 hours, 4 hours and all that. Let them not use that. Also, if at all they have to listen to music, maybe half an hour in a day is fine. So the next thing is, I have seen people digging the ears with earbuds. What all can happen with this? One thing, the earbuds may carry some fungal infection with them, and once the skin is breached, they can develop a bad fungal infection of the ear. Also, if they go a little deeper, they can also injure the eardrum. Once they injure the eardrum, the consequences are that, one thing, it might heal up completely, or second, there can occur secondary infections with bacteria, which can lead to ear discharge, pain, and other things, which may become a permanent problem, and the hole may become a permanent hole in the eardrum. So this has to be surgically addressed later on. Unnecessarily, to clean one ear, they land up with such a problem. So what I would say is, don't use earbuds. Let the nature take care of it. The ear wax comes out by itself when you are taking head bath and other things. So once a year or once in 2 years, you can see us to ensure that there is no wax in the ear. And the third topic I would like to address is in children, especially around 2 years. What happens? The parents come with the child is having nasal blockage, it's snoring in the night, and getting recurrent colds. But the most common problem around it, which starts around that age, is adenoids. There's a gland called adenoids behind the nose, just like tonsils in the throat. When this gland gets repeatedly infected, then it starts increasing in size, and then it blocks the nasopharyngeal airway. That is, the airway behind the nose, it blocks. So normally a person takes the breath through the nose. It has to go behind the nose and then into the lungs. But because the nasopharyngeal airway is blocked, the child starts taking breath through the mouth. So slowly the tonsils also start getting infected because the breath that is taken is not filtered like it is filtered in the nose. So tonsils start getting infected. In turn, the adenoids start getting infected, and then this becomes a routine cycle. And because the child breathes through the mouth, it starts snoring. And when the parents come to us, we do suggest if it is very badly snoring, if the child is snoring very badly, then we do suggest surgeries for this, because adenoids have to be removed. Otherwise, it has its own complications. The thing is, it can cause hearing loss because the connection between nose and the ear, that is the eustachian tube, can get blocked. And it can result in a collection of fluid in the ear, leading on to hearing loss. The second thing that can happen is bad formation of the teeth, because only when the child breathes through the nose, then only the maxilla, that is the area where the upper jaw is there, the teeth, that comes to normal shape. If that is not in normal shape, then the teeth gets crowded, And the third thing that can happen is a widening of the nose. We call this as adenoid facies. Okay, so this is again, some parents do come to us at a very late stage when all the adenoid phases is already developed, and reversing this again becomes a problem. We, the doctors at Manipal Northside Hospital in Malleshwaram, have the best of expertise, combined expertise, as well as best of facilities. We will give you the best treatment in this hospital.